Okay, welcome. My name is Paige Picorni. I'll be your host for today. Today's webinar, thank you for joining. It'll be all about centering equity in policy and highlights from some amazing organizations in Louisiana. Before we get started, a few housekeeping notes. The webinar is being recorded and the slide deck will be shared to all attendees and registrants via email after the call. We'll also have time at the end of the presentation to hear from you. So please place all of your questions in the Q&A box. Any questions we do not get to, we'll follow up after the webinar. Also, we encourage you to use the chat box throughout the session to engage with each other and the speakers. There's a variety of people on the call with a lot of cumulative experience, so I encourage you to talk with each other and with the speakers using that chat box function. And a note for this specific webinar, this project is actually supported by a grant from the Health Impact Project, a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust. However, the views expressed are those of the authors and do not necessarily reflect the views of the Health Impact Project, the Pew Charitable Trust, or Robert Wood Johnson Foundation. Now for today's agenda. So after some welcome and introductions from me, we'll kick it over to Janine Rios to learn all about why equity. Janine Rios is a senior program manager with Share Our Strength Center for Best Practices Education and Training team. Her work focuses on school meals and she has been critical to embedding equity, diversity, and inclusion principles and practices into our work. Next, you'll hear from Susan East Nelson. She is the Executive Director of the Louisiana Partnership for Children and Families, the only statewide organization connecting child-serving organizations together to advocate for better outcomes for all children. In her capacity representing the partnership, she is currently the chair of the Children's Cabinet Advisory Board and sits on the Children's Cabinet. Ms. Nelson also served on the Research Advisory Committee for several Louisiana ALICE reports and serves on the Louisiana Anti-Hunger Coalition. Next, you'll hear from Stephanie Loop. She works as an education program consultant at the Louisiana Department of Education. She has a bachelor's degree in sports medicine and went on to get her registered dietitian credentials and master's in public health from the University of Minnesota. There, she specialized in maternal and child nutrition and local food systems. At the Department of Education, she recently completed a series of projects with the Pew Charitable Trust Breaking Barriers grant, through which the department highlighted CACFP at risk and SFSP program outreach. Last but not least, you'll hear from Danny Mintz. He is the director of the Safety Net Policy at the Louisiana Budget Project, a nonprofit, nonpartisan organization that advocates for state policies that benefit people with low and moderate incomes in Louisiana. At LBP, Danny leads the organization's advocacy for more accessible safety net. Danny holds a PhD in English from the University of Michigan. So as you can see, a fantastic array of panelists today talking all about centering equity in policy and their projects that they've been working on through this grant project. So please be sure to keep those questions in your mind, put them in the chat box because we'll have ample time to learn from these folks as we move through today's call. And if you're new to us, I do want to introduce No Kid Hungry. No Kid Hungry is a campaign of Share Our Strength. We are committed to ending childhood hunger in the United States by helping launch and improve programs that give kids the food they need to thrive. And myself and Janine sit on our Center for Best Practices team, and we provide information, tools, and resources designed to end childhood hunger and support providers. And that is our website. It has a wealth of resources, information, so please do check it out. Last but not least, I definitely want to say a thank you to any food providers on the call. I know the last 2 years have been tough, and so I just want to throw a quick shout out and say thank you for all of the work that you do to feed children. And with that, I'll pass it over to Janine.
Awesome, thank you. And we can go to the next slide, please. We're just going to jump right in, talk a little bit about what is centering all of our work right now. And that is going back to equity and really thinking about what equity is. It's the quality of being fair or impartial. And I know it sounds a lot like equality, but it's a little more complicated than that. To treat people equally is giving everyone the same resources and opportunities. But when we talk about equity, we're acknowledging that not everyone has the same circumstances. And it means providing the necessary resources so that we can get everyone to the same result and the same endpoint. And there's so many ways to give an example of what this is. And I think the most recent one that I heard that made a lot of sense is giving everyone the same size shoe, right? Some people it's going to fit great. You're going to be comfortable. You're going to be able to walk all day. Well, other people, the shoes are just going to be too tight or too big, and it's just not going to fit their situation or their need. So it's important to just really think about equity and really lifting that up. Why is it important? One of the factors and one of the big umbrellas is that we do have structural systems in our society, such as racism, that have created systems of inequality. And so historically, there have been communities that have been marginalized, that are still at disadvantaged situations. There's still discrimination and subtle ways that we aren't getting the same resources or the same access. And so what is one solution to all of this, and something that's on all of our minds, is equity. So really lifting that up, thinking about that in everything that we do. Next slide, please. And so on the ground, real life stories that you're going to hear today really look at how to minimize these barriers. We really are focused here on decreasing hunger. And in the schools, looking at the schools is one fundamental step and way to reduce racial and economic disparities in our communities. We want to make sure that kids of all backgrounds get fed. So it's important to really acknowledge these barriers and think about how we can creatively prevent kids from missing these meals. One of them that we've seen is the language barrier. So it could be offering, making sure that we have, whether that's materials, whether that's, picture forms, we want to make sure that we are having resources in multiple languages and those that fit our community. Same with the types of food served. We want to make sure that they're culturally relevant and really fitting the needs of our communities. And that could be cultural, it could be dietary. There's so many ways that we need to make sure that we're looking at the foods that we're served. And something that we're all going to talk about today is really just going back to your community and asking them, what is it that they want? We're really building those relationships so that you have that access and that avenue for information. Comfortability with staff. Oh, we're still on this slide, sorry, Chelsea. Comfortability with staff. So that goes back to really building those relationships with kids and making sure that our school environments represent the communities in the way that we look, in the way that we relate to the kids. So ensuring that staff are representative of those we serve. When talking about bus schedules and locations of meals, we really want to highlight the importance of having alternative meal models. That way we can get to our participants and we can be there in whether that's off hours. Sometimes in traditional models, we have school before, we have breakfast before school starts, right? But sometimes if the student gets there late or whatever happens, you miss that meal. Or if you're in high school and you don't get hungry until 9 o'clock, you don't necessarily want to eat that early. Having those alternative meal models and food available for kids in different places and at different times is really important. And then something we're all holding our breath about is return to paid meals, which will inevitably lead to situations where there's going to be families and kids who can't afford the school meal and or an increase in school meal debt. And so we want to look creatively at ways to either provide meals free, whether that's CEP or other after school programs, having schools meals for kids, and just really being intentional about decreasing stigma. And that looks like crafting policies that really centers equity and the experience and lives of children and families. Next slide, please. So last but not least, I definitely want us to look at what does that look like? What are we thinking about when we talk about equity? And it's that American families are going hungry. You know, there's a lot of people experiencing hunger, and we want to remember that all families do not experience hunger equally. There's a disproportionate amount of children of color that are impacted by food insecurity, as you see in the slide here, whereas we have 21% of Black families, 17% of Hispanic households are experiencing hunger in comparison to 7.1% of white families. And we know that the impact of food insecurity can be long lasting. It can affect just ways of learning and health. And so we want to make sure that we get ahead of all that as much as we can. And one thing to think about is the drivers of food insecurity. And under the umbrella of systemic structures and racism that affects all of these, we want to think about consciously just those of us in our community who are, dealing with disability, home ownership, median income, poverty, and unemployment. And these are all drivers that really impact the access of nutritious meals for families and kids. And so we know also that one way to combat this is really increasing that access for kids in schools. And we're going to talk all about that today. And we really want to just keep mentioning the importance of talking to our families and finding out in our communities what's really needed. And I'm going to pass it to Susan for more information and more exciting programs.
Let me unmute. There we go. Thank you so much, Janine, and good afternoon to everyone. My name is Susan East Nelson. I'm with the Louisiana Partnership for Children and Families, and we'll just get right into the summit that we hosted earlier this year. So we had a in-person summit here in Louisiana in February, and I'm going to couch that by saying there was actually a surge in COVID in January for our original date. We ended up actually moving it to the February date. But it was the first opportunity that we had for a lot of kids, a lot of the folks in the food nutrition and the child serving organizations that do work around food to get together and see each other face to face for the first time since COVID. So there was a lot of excitement and energy around that. And our theme for our conference was "We Nourish so that they can flourish." We actually gave out little insulated lunch totes so that folks could remember that from the event. Next slide, please. So we focused on specifically where we feed children, how we feed children, and what we feed children. And we also took a moment and lots of time, more than one moment, to celebrate those who had worked to feed children in the last 2 years under very trying circumstances. There was a great awards presentation from the Department of Education. It was an opportunity for them to recognize some really outstanding leaders and really just celebrate the fact and have some space really for folks to take a break, take a breath, and realize the work that they had been able to accomplish during the pandemic. Next slide. And so we had a variety of topics here. We had folks from the LSU Ag Center. We had Danny Mintz, who you're going to hear from later. But these were our topics. We also ended up with these head of special nutrition programs from the USDA, Eddie Longoria. He spoke and kind of kicked off our conference. But lots of great plenary sessions as well as breakouts to really delve into some of the issues of feeding. And as you can see, it really ran the gambit. We had everything from infant feeding all the way to, Louisiana Festival of Flavors, which is a great project that they've been working on between the Pennington Biomedical Research Center and the Department of Education. So it was a great opportunity to have just a variety of topics and folks to get some time to chat with their colleagues, but also to hear some information. and really share some of those ideas on how to automate or how to innovate in the world of feeding children. One of the things we did on the first afternoon was a relationship mapping opportunity where we actually handed out relationship maps that were blank for participants to think about folks in their community that they can engage as they did their work to feed children. And so many of the participants said, you know, they hadn't ever had the time, certainly not during COVID, to just sit and think about the relationships and what they could do to increase their capacity through looking at that. Next slide. So we had a number of partners. It was definitely not a solo mission. We had a lot of folks working on the summit. So we had, of course, No Kid Hungry Louisiana. The Pennington Biomedical Research Center was actually where we hosted the summit, and they also were presenters and helped us put together some of the sessions. We had the LSU Ag Center, of course, our great friends at the Louisiana Department of Education, Louisiana Budget Project, the 3 O'Clock Project, and the Save the Children Action Network. So it was definitely a lot of partners. And if you want to replicate something like this, I would really suggest that folks reach out to the folks that they work with in their communities and get all of these folks together, because we really had a variety of sessions due to the fact that we had these great partners. You can see some pictures here from our obesity, and they spell it OBECITY as in an obese city. That's a project of the Pennington Biomedical Research Center. And they really talked about some of the factors that were contributing to obesity in communities, like, you know, fast food restaurants outnumbering grocery stores 6-1 in certain areas. So certainly brought to the forefront all of the issues that are involved in feeding children. Next slide. And so some of our outcomes were, first off, time and space, just to think about networking and what we needed. Sharing information, the ability to connect and sit down with folks and have a conversation, which is obviously something that people were both hungry to do, and we had a good environment where we had lots of space and time for folks to sit down and connect. Sharing information about partner programs. The Department of Education has done an incredible amount of innovation in our state, and it was a really good opportunity to share that information with school districts that maybe hadn't thought about or maybe weren't aware of some of the great successes that their neighboring school districts had had. Celebrating excellence, and we had a platform for the department to actually give out awards, which was really great. And then the whole event was covered, and we had a statewide media coverage with short segments on local TV, as well as a statewide longer piece. And you can actually see the whole video at that link here. But next slide, I want to share just this great takeaway from our friend Emily Chatelaine, and in 30 seconds, it'll tell you sort of why we did what we did. Go ahead.
We learned that the best way to reach the kids most in need is collaborating. You cannot do this alone. You will not reach all of those who really need your help if it's just you by yourself. And that's what we've kind of really learned well through this, and seeing the beauty and the silver lining of COVID, and all of these organizations kind of come together and say, no, this is important, and we're going to pause what we're doing because it's really important to feed these kids.
So, you know, really sharing that idea and saying that, you know, we've had, obviously COVID was a very difficult situation, but in Louisiana, we are no stranger to hurricanes that shut down our schools for weeks at a time. And so really channeling all of the energy of this crisis into how do we globally think about the next crisis, and how do we work together to improve our capacity to feed children at all times throughout the year. So with that, I will go ahead and turn it over to our next speaker, who is Stephanie.
Hey everyone, thanks Susan, and thank you to No Kid Hungry for hosting us and being a support to the Louisiana Department of Education. My name is Stephanie Loop. I'm an education program consultant with the Louisiana Department of Education Division of Nutrition Support, and we are the state agency for the state of Louisiana for all child nutrition programs. So today I'm going to be discussing a model that our agency has found to be beneficial for supporting communication between sponsors and the state agency, as well as supporting communication between sponsors. We feel that other state agencies or sponsors may find utilizing a similar model beneficial to promoting communication, which we all know is so essential to operating child nutrition programs. So as you all know, March 2020 brought huge challenges to how sponsors and state agencies operated. Like many other states, all state agency staff needed to transition to remote work during the pandemic, and we quickly had to switch from in-person trainings and technical assistance to virtual methods. We started town hall Zoom meetings multiple times per month to inform sponsors of challenges and other notifications, and we also at that point initiated a weekly call to each sponsor each week to discuss how they were navigating the pandemic and to make sure they had the information they needed to continue operations. Our school systems were absolute heroes. Most of our school systems continued feeding students, just like so many of you did all over the nation. And from there, our director had a vision for implementing a small work group in one of our urban areas to crowdsource ideas, resources, and communication between the state agency and sponsors. One of the primary purposes of the work group was to identify gaps in service. The idea was to start in one densely populated parish, which is what we call counties in Louisiana, and we wanted an area with multiple school systems in it. The state agency wanted to find out straight from the C&P operators if they perceived any gaps in service to their students. So we individually contacted each SFA to notify them about the project, and we surveyed each of them to see which programs they were operating: school breakfast, school lunch, and after school feeding through after school snacks or CACFP at-risk snacks or meals. We also identified the methods through which they were operating during the pandemic. We wanted to ensure that there weren't large gaps in service throughout the community, and we knew that going to the source or finding out from frontline operators, that was the best way to ensure we weren't missing any of the children who were in need of services. We also knew how hard the pandemic was on operators, so we wanted to facilitate a forum through which sponsors could have conversations, ask questions, and get feedback on anything they needed advice on. We wanted this to be a work group that could benefit the SFA as well as becoming a catalyst for open communication. Next slide. All school sponsors located within East Baton Rouge Parish were invited to participate in a work group meeting via Zoom. In late 2020, when this was initiated, there were 23 sponsors represented in the parish. We contacted each of the 23 SFAs by phone to discuss the purpose of the work group and to see when the SFA may be eligible to meet. We felt that the initial one-on-one contact was important to the initial buy-in of the group, and after the initial contact, a Zoom invite was sent out with the purpose of sharing ideas about best practices, success stories, and then to identify any gaps in service. Our first meeting was held in January of 2021. We had facilitated round-robin discussions where we were able to hear from each of the SFAs about their programs, perceived gaps in service, and also those things they felt were victories during the pandemic. We also wanted to ensure that sponsors were aware of all the programs that they had access to. Of course, they were operating NSLP or National School Lunch Program and the School Breakfast Program, but that CACFP at-risk snack and supper and after-school snack programs were also available, and good opportunities for both children and school food service programs. Next slide. We wanted the work group to be something beneficial for SFAs. We didn't want it necessarily to be an informational session with the state agency, although SFAs often had questions that we were happy to discuss, but we wanted those in the group to feel ownership in the group and to feel like it was theirs. I really tried to work as a facilitator of discussion rather than the head of the group. Some of the outcomes of our pilot group were expected, while others were more surprising. We found that most SFAs believed that they were providing the right services and that C&P programs for their student population. Some had tried offering at-risk programs in the past with poor participation, and others were offering the program widely across the SFA with great success. We found that there was no one-size-fits-all set of programs for all schools. However, we did have situations where an existing SFA was in need of services, such as for SFSP over the summer months. And through this group, we were able to connect them with a willing sponsor who could furnish meals for them and their students over the summer months. And that was a really exciting win for us. We also had schools that initiated after-school snacks, Again, this was a great outcome to the work group. We were able to walk them through the logistics of starting an after-school CNP program. In the past, we've had times where multiple sponsors have tried to sponsor the same SFSP feeding site in the summer, and this group decreased that competition by keeping communication about summer feeding open and straightforward. One of the less anticipated outcomes of the work group were the discussions on supply chain and staffing shortages. The group really came together to discuss how they were and are dealing with these issues. They shared tips and strategies with one another, as well as sharing camaraderie. The state agency was able to convey these issues to USDA and really feel like we had a good sense of what was happening in the field. These conversations also resulted in a work group for the 5 largest districts in the state to discuss supply chain issues. As the largest districts in the state, we felt like it was also important for them to gain insights from each other to address the challenges of feeding children with unprecedented shortages. Next slide. With the success and experience of the pilot group, the state agency decided to expand outward to a region of the state with a mixture of urban and rural populations. So in August of 2021, we started reaching out to the Northwest region of the state, home to Shreveport, which is one of the state's metro areas. This group was a little bit different in that the members were mostly parish-wide SFA directors. So each director has their own parish and programs without much overlap in populations. And like I mentioned, it's a very good mix of urban and rural settings. This group started in September of 2021, and the group meets every other month in person, so I'm able to meet with them alternating between in person and on Zoom. One month we featured a Zoom presentation by a director of a successful at-risk supper program in another parish, and the work group was able to ask questions and gain insights on how the at-risk program worked. I also did another presentation on at-risk programs to answer questions, as this program did not readily operate in this part of the state as it did in East Baton Rouge Parish. So from there, groups were started in Southwest Louisiana and Northeast Louisiana this year, with groups now covering around 40 of our 64 parishes in the state. The Southwest and Northeast groups both meet monthly in person, and each group has established its own needs and personality with the same goals of identifying gaps in service, sharing best practices, and encouraging one another with success stories. Okay, I'll go to key outcomes. So what were our key outcomes from the 4 child nutrition program work groups? We were able to connect sponsors with needed services. As I mentioned earlier, a small SFA was able to connect with a larger sponsor for summer feeding when their vendor contract was not in place. Caddo Parish, which is the parish for Shreveport, did implement at-risk feeding programs at 17 sites. We also saw open communication between sponsors. It's amazing to watch sponsors encourage one another with new ideas and best practices that they've developed to handle barriers and challenges during these tumultuous times. We also saw this wonderful line of communication between the sponsors and the state agency. The state agency wants to know what's happening in the field, and especially earlier in the pandemic, it was really difficult for us to go into the field and see directors regularly face to face. So this avenue of communication opened up so much good information about supply chain issues and different concerns that directors had. This is one of the ways we kept track of sponsors' ability to meet meal pattern requirements. This was one of the ways we identified areas that the state agency needed to communicate more clearly to sponsors. And the groups really ended up being a really good way to channel information to and from sponsors. In the end, we met our objectives while also meeting the needs of sponsors. Next slide. There were and are some challenges to this project. We did find some decrease in participation with smaller SFAs that may not always feel the pressures that larger systems experience. I think smaller SFAs also often have directors that have multiple duties. They may be the only ones directly involved with the child nutrition programs. Another challenge was not always having the answer as the state agency. It was difficult to hear about all of the challenges our sponsors were facing and not always having a solution for them. But we could provide ideas, but we couldn't necessarily solve supply chain issues or staffing shortages. It was difficult to feel powerless to help in situations like that. It was also difficult to not always know how feeding would evolve throughout the pandemic. We didn't know which waivers would be extended, and we didn't know which waivers wouldn't. We didn't know all the twists and turns that child nutrition programs would take over the course of the pandemic. Next slide. At the state agency, we want to reach those children who are the most vulnerable. We want to ensure that we're capturing the most needy children and giving them the services they need. In order to do that, we have to go to the source. We have to find out from the communities what the needs are. These work groups have been an excellent way of relationship building and going to the source on these issues. I believe these work groups have been relationship building. It's built rapport between the state agency and sponsors. It's shown that we are on their side and that we're ready to support them however we can. The work groups have also been a good way to provide a clear understanding of the existing CNP programs that are available. It also gave the state agency insight into the very real challenges in the field. And lastly, the work groups opened up communications between sponsors and the state agency. Next slide. So what are our recommendations? I would say start a group. You can start small like we did with a targeted audience. You may have some agenda that you want to accomplish, but so much of this is about relationship building. One of the most important things I learned is to listen and to be more of a facilitator than an authority in the group. So much learning and exchange of knowledge happens when you listen and allow the sponsors to share with one another. They have so much wisdom and experience. I'd also recommend meeting in person when it's a possibility. There's something that happens in person that allows you to connect in a different way, and that facilitates good conversation. I do always come prepared with a few state agency announcements and often some information on meals served outside of school times, but come prepared to facilitate and listen. If you do meet on Zoom or Microsoft Teams, there's certainly benefits to that. You may capture a wider audience that otherwise can't leave their facilities. But if you do meet online, make sure you encourage cameras to be on so you can have that more personal interaction. But on video conferencing platforms or in person, the benefits of the child nutrition work group are so worth it. So consider starting one in your community. Well, thank you so much for the opportunity to discuss this with you all today. I'm happy to answer questions at the end of this presentation. I have listed our general email address, which is childnutritionprograms@la.gov, or my personal email address if anyone has questions for us. But I will turn things over to Danny now.
Thanks so much, Stephanie. And I want to thank you not only for turning it over to me, but also for the tremendous work that you did to establish these working groups and to maintain and expand them. And also for the presentation, which I found deeply engaging and informative myself as somebody who works in Louisiana. I wanted to, so my presentation essentially is to say everything that Stephanie said, but also for policy. Because one of the things that Stephanie mentioned toward the end of her presentation is that there was a certain point where, despite the tremendous relationship building that these regional working groups allowed, and the new opportunities for sharing among practitioners best practices to overcome some of the challenges of the pandemic era, there were certain aspects of the pandemic era which we are still in, namely staffing challenges and supply chain issues, but certainly others as well, where both the practitioners at the table and the state agency felt powerless. And the main message that I would like to convey in my part of the presentation today is that while it's not a panacea and it won't solve every problem, one key additional step that practitioners in particular can take beyond sharing best practices internally and implementing those best practices is to make sure that our policymakers at both the state and federal level know what's going on the ground. I think some of the barriers that exist toward realizing the potential of more equitable access to child nutrition programs and toward realizing improvements in child nutrition programs exist in policy. But policymakers all too often aren't aware of how some of the policy choices that they've made, even very well-intentioned policy choices, may hinder the effective operation of nutrition programs on the ground. So next slide. What I'm going to talk about a little bit today is the child nutrition reauthorization process, which I noticed that when I scanned through those of you who identified your organizations in the chat, I know there are many people who are deeply familiar with child nutrition reauthorization because of the impacts that it has on your operations as a state agency on the call already, as well as many practitioners who may also know a great deal about child nutrition programs as they come to exist on the ground. Again, my main overall message is that it's very important to engage policymakers from an educational standpoint, even if you can't lobby. If as a state employee, for example, you're not able to advocate for a particular change in a law at the federal level, you can certainly make it clear to your representatives in Washington, especially if they serve on the House Education and Labor Committee, just what the conditions are on the ground in the child nutrition programs that you operate or that you oversee, and what improvements may need to be made in law to ensure that those programs can be more effectively implemented on the ground. Next slide. So just as a quick overview, child nutrition reauthorization covers a great many programs, some of which I think a lot of people on this call are likely to have a day-to-day familiarity with, some of which may be less common. But child nutrition covers the WIC and WIC Farmers Market Nutrition Program, the National School Lunch Program, the School Breakfast Program, Child and Adult Care Food Program, Summer Food Service Program, and the Special Milk Program. The way the policy making process works in general is that Congress passes laws that define the parameters for how these programs operate. The U.S. Department of Agriculture interprets those laws into policy, into regulation and guidance, and then state agencies further interpret that guidance and oversee the on-the-ground implementation of these programs. Obviously, sometimes these different programs live with different agencies. In Louisiana, WIC lives with the Louisiana Department of Health, and the remainder of the programs on this screen live with the Louisiana Department of Education. But for practitioners in the field who aren't state employees or state agencies, one of the main interactions that you're likely to have with policy in this program, aside from implementing it, is in talking with your state agency about questions that you have about what's allowed under the rules, changes in the rules, waivers of the rules, as became very common, increasingly common during COVID, and what these all mean on the ground. Next slide. Child nutrition is now 7 years overdue for reauthorization. It was last reauthorized in 2010, and in general is expected to be reauthorized every 5 years. Clearly, that has not been the norm recently. And unfortunately, the delay in child nutrition reauthorization also delays opportunities for improving programs, for streamlining the administration of various programs that serve children and ensure that they have enough to eat. It delays opportunities for increasing equity by both increasing proactive options to help support schools and sponsors in reaching underserved populations. And also, frankly, delays the ability of child nutrition programs to keep up with changes in the surrounding world. Short of the pandemic, a lot has changed in all of our lives since 2010. And with 12 years now having passed since the last child nutrition reauthorization, unfortunately, our child nutrition programs may not fully reflect the reality that we currently inhabit. Next slide. So I'd like to take a little bit of a case study by looking at summer meals and the summer food service program, and to talk about how the summer food service program could be modified in an upcoming child nutrition reauthorization. I've chosen one marker bill, and a marker bill is essentially a bill introduced in the federal government, in Congress, that lays out priorities that may then be adopted in child nutrition reauthorization. Marker bill may not be precisely the most appropriate term, but essentially, this is a bill that's been introduced that is could potentially be passed on its own, but the higher likelihood is that some of the proposals from this bill and other bills that have been introduced could be incorporated into a child nutrition reauthorization process. The Summer Meals Act of 2021 would make some significant substantive changes to the school food service program. It would lower the area eligibility threshold to 40% from its current threshold of 50% for operating an open site on an area or a closed site on an area eligibility basis. It would allow some sponsors who administer both the child and adult care food program and the summer food service program to simply operate SFSP year-round, eliminating the paperwork hurdles involved in transitioning from one program to the other while serving the same children, but simply changing arbitrarily because the calendar has advanced. It would provide transportation grants for hard to serve communities, which, as we'll see in a moment, would potentially be quite meaningful in Louisiana. Would allow for service of an additional meal to get more nutrition to children in need, and certainly a very significant concern in Louisiana, which has faced, I believe, 12 federally declared disasters over the course of 2021 alone. It would waive congregant requirements in disaster situations. Obviously now during COVID, when congregate requirements have often been waived as a matter of course, this has not mattered as much. But I think one key question that lawmakers will have to address in the relatively near future is, how do we transition to a post-COVID world in child nutrition programs, and what should our priorities be in making sure that child nutrition programs benefit from the lessons of these very, very challenging years, and from the opportunities that efforts like Louisiana's regional working groups have created to solve problems in closer to real time, and collaborate more effectively to overcome some challenges and barriers in child nutrition, school nutrition access. Next slide. In Louisiana, this is particularly important in the summer food service program because access to SFSP sites tends to be fairly unevenly distributed across the state. Of course, during COVID, when the vast majority of our schools, of our state's feeding programs transitioned to SFSP, these numbers look very different. But in 2019, before the pandemic, we saw some parishes that had, for each summer food service program site, about 0 to 500 children in poverty that site would theoretically serve. And for other parishes, much higher potential need for each site that would be serving children, from 4,000 to nearly 5,000 children in poverty for each site. There are a number of different equity issues that are embedded in this map. The parishes that tend to have the fewest sites per child in poverty, or the most children in poverty for each site, tend to be rural parishes, also tend to be parishes with very high poverty rates. Unfortunately, these parishes face significant barriers to serving children. This is an area where collaborative efforts that help share best practices certainly have great promise. It's also an area where our lawmakers at both the state and the federal level should be more fully aware of the challenges that exist, so that they can prioritize opportunities like additional transportation funding and other creative solutions to serving rural areas that would help increase access in a lot of the areas, not only in Louisiana but in other states as well, where children not only have often very few resources within their families to get enough food to eat during the summer, but also, unfortunately, many fewer options for accessing meals. I really hope that that in the future, as we move toward what I hope will be a near-term child nutrition reauthorization process, that that some of the insights that are bubbling up through the conversations between practitioners in Louisiana make it to our representatives in Washington. But I also hope that in other states, similar efforts and similar collaborative efforts that I'm sure have increased in strength and frequency over the course of the pandemic continue to bear fruit, and bear fruit not only in solving problems locally, but also in communicating those problems to policymakers, and helping, where possible, policymakers to understand why it's so necessary to craft federal solutions and devote federal resources, and state solutions and devote state resources to overcoming access and equity issues, and to knowing it on a deeper level what's going on the ground, and why kids in every state don't necessarily have full or equitable access to the meals that they need to thrive. The note I'd like to conclude on is just one sentence on the next slide, and it echoes again really the core message of what Stephanie presented earlier, which is that practitioner voices matter, both to state level policymaking and to federal policymaking, as well as to policy implementation, and that particularly to meet the goal of centering equity in child nutrition programs, and centering equity in child nutrition policy, making sure that practitioner voices are making it all the way to the people who are making policy directly, is really essential to making sure that that our federally funded and state implemented programs meet needs of every child in all of our states. And thanks so much, Paige and Share Our Strength, for organizing this. And as Paige noted in the chat, I think we're all very happy to answer any questions that folks have to share.
Thank you so much, Danny, Stephanie, Susan, Janine. That was fantastic. I've knew what you're going to talk about, and I still learned so much. So now we do have some time for Q&A, probably 5-7 minutes. So to start us off, what is one thing you wish you would have known before starting your project or this process? You know, what would you like to tell yourself, you know, a year ago or so? And I'll let anyone who wants to jump in first go ahead. Go for it, Susan.
I'll just say, you know, I wish I would have known exactly when COVID was going to peak here in Louisiana before we started planning our summit. That would have been really good information. But no, I think I wish I would have known sort of like where we were on the trajectory. Maybe we would have pushed it a little bit later to get more people to come. I know even our local chapter of Share Our Strength was like, oh yeah, we can't be there because we're not allowed to participate yet in in-person conferences. And so, you know, I wish we could have kind of navigated that a little bit better through the process.
Any major lessons learned, Stephanie?
You know, I'm having a hard time thinking of something that I wish I had some, you know, hindsight on. Maybe I wish I would have known, you know, that we maybe could have started this sooner. You know, I think it's been really beneficial. And if I can think of something, I think that would be it, that maybe this is something that's worked well, and it's something that maybe we could have started at the beginning of the pandemic, or if we had had it in place before the pandemic, it may have been a really useful way to disseminate more information.
Yeah, for sure. Danny, go ahead.
Yeah, no, I would echo that. I just think it's such a wonderful effort, Stephanie, that y'all have developed. And speaking as somebody who works in this space only from a policy perspective, I wish we had a better sense of how the situation on the ground was evolving in real time for for people in our state who were trying to serve meals to kids in extraordinarily challenging circumstances, to better inform our advocacy. The other thing that I would say is that, relatively early in the pandemic, the Louisiana Department of Education applied for a statewide community eligibility waiver. Ultimately, other waivers made that less relevant because they allowed for universal feeding. But Louisiana, unfortunately, has such tremendous rates of child poverty that we would qualify for CEP on a statewide basis if we were grouped together as one sort of unified district. And I think going into the pandemic, especially in those first months, this isn't something I wish I knew, but rather something I wish we had. I wish that we could have had, as a statewide policy, community eligibility for school meals, not only because it would have made response to the pandemic, I think, a lot easier statewide, but also because, I think many of where the equity issues are, one area where equity issues are particularly acute is in inequitable access to universal meals across the state. And often it's people who live in poverty in comparatively wealthy parishes that suffer from that particular inequity. So I do wish we had that earlier. And yeah, I wish I knew more right at the beginning about what was going on.
Mm-hmm.
I will say this to Danny's point, it's now started a conversation in Louisiana about, why do we charge students for reduced lunch? Like, can't the state pick that up? And then it's actually lended itself to a larger conversation about why do we charge for school lunch at all? And I think we could not have had that conversation had we not seen some of these issues with CEP access and eligibility that were really brought to the forefront because of COVID.
Mm-hmm. Thank you for that. I agree. So we'll just have probably time for one more question. So I'll ask a future thinking question. What's next? What's next for the summit? What's next for the regional work groups? And what's next for, I know you don't have a crystal ball there, Danny, but however you want to answer the question, what's next?
I can go first on this one. I think what's next for us is that we plan to continue the work groups, and we plan to expand into the South Central and southeastern part of the state. And so I was just having this discussion this morning with my supervisor. And so that's something that we're going to continue doing, and hope that it remains a fruitful thing for the LDOE.
Susan?
I think for us, definitely, just as an example, tomorrow is Early Education Day at the Capitol, and we've invited the department to come and talk about CACFP with legislators, because I think we need to continue the education that we've been doing around this issue, because so many legislators don't even understand that there's like two completely different programs that feed kids, sometime within the same educational environment. And so really kind of ramping up our education to eventually get them to the point where they're making some policy decisions at the state level that can really help increase access for all these children.
And for our part, I mean, I think what's next is to really do some real work to try to learn more from the insights that that folks on the ground have had from the past couple of years of work during COVID, and translate those insights to federal policymakers to the greatest extent that we can. Also on the horizon for us really is trying to figure out how we can institutionalize better data collection about equity issues in program performance. What coming off of the pandemic, what figures should we be looking at? What measures of access are most important, not only for us to know about, but for state policymakers at the agency as well as state legislators to look at, to better understand where additional resources might be needed, or where technical assistance or simply changes to statute, either at the state or the federal level, might help make programs more accessible, particularly for populations currently underserved by programs in Louisiana.
Awesome. Thank you all. I'm going to turn it back over to Janine, who's going to close us out with some resources. But I also, Danny alluded to, this post-waiver world, this post-pandemic world. And I'm curious if any practitioners are on the call, if they want to share in their chat what their plan is for the future and next year, this summer. We'd love to hear it in the chat. Janine?
Sure. Also, thank you so much, Paige. We just wanted to review a few of our resources that we hope could be helpful. One of them is advancing equity. So designing your programs at the front end so that they reach every child. So definitely check that one out. Then another one specifically looking at what types of conversations, what kind of questions can you ask your community or ask your team so that you are covering and making sure that you are reaching all kids and families that need access to these programs. Then we have a resource for rural communities and just kind of highlighting some best practices that have been done across the nation. And I didn't want to miss out on the Nebraska created a school nutrition equity in Nebraska webpage. It's completely amazing. You have to check it out. Use and reuse their resources. They took a lot of time and energy to put that together. Definitely check that out. Then we have a whole series, Conversations on Food Justice. It talks about just all the unique needs and challenges among marginalized communities in our nation. And then we have a Spotlight on Equity that highlights all the different and amazing things y'all are doing out there. We have 5 schools and organizations highlighted so far, but we're always looking for more stories. There's a link in there where you can add your story so we can highlight you as well. Because in some cases, we don't even know what that looks like. What is the first step? These are examples to show maybe you're already in that path. You're already, translating resources and having culturally appropriate meals, et cetera, et cetera. So definitely check that out. And for all your resource needs, we have an entire webpage focused on equity and child nutrition. So definitely check that out as well.
I can jump in here. These cover my summer world. So we have a few new resources. The first about transitioning back to congregate meal service and tips for doing that successfully, both in strategy, but also messaging. And then knowing that summer might look different this year, we have a communications toolkit where you can quickly, easily copy and paste language to modify communications to parents, flyers, about either changing program operations or closing operations. And this is a doozy of a resource, but we do have a side-by-side comparison of usual summer meal service and also what waivers allowed, to remind and refresh us all of what the operations and regulations looks like without the waivers. And I do want to plug our future webinars. So we've had 2 so far, and one is coming up just next week about promoting your summer meals program. And then we have a fantastic webinar on evaluating incorporating feedback. I just had a meeting about it today. It's going to be a good one on June 9th. And then sometime in July, we'll be talking about transitioning to year-round feeding using CACFP at risk. And please do stay in touch if you want to get to know about future webinars, resources, grant opportunities. Do subscribe to our newsletter and be sure to visit our CVP website. And I just want to thank you all. Our information is here if you want to get in touch with Janine or I. And a huge thank you to our panelists, our presenters. I've really enjoyed working with all of them, and they are here as a resource. So definitely reach out if you want to learn more. Thank you so much, and I hope you have a great day.